Patients diagnosed with mesothelioma caused by exposure to zeolite face many significant medical and personal challenges throughout their journey with this disease. Mesothelioma is an aggressive form of cancer that develops from the mesothelium, which is the protective lining that covers most of the body's internal organs. It is usually caused by exposure to asbestos, but some cases have been linked to exposure to zeolite minerals. Some of the major medical challenges zeolite mesothelioma patients face include pain management. Mesothelioma often causes severe, chronic pain as the cancer spreads. Effective pain management is crucial to a patient's quality of life but can be difficult to achieve. The pain tends to worsen as the disease progresses. Breathing difficulties. The pleura is the most commonly affected site in mesothelioma. As tumors develop in the pleural lining of the lungs, it can cause shortness of breath, difficulty breathing and even respiratory failure later in the disease course if left untreated. Managing breathing issues is a key challenge. Nutritional deficits. Symptoms of mesothelioma like pain, digestive problems and lack of appetite can seriously impair a patient's ability to meet their nutritional needs. Decreased nutrient intake leads to weight loss and weakness. Early intervention with dietary supplements and feeding tubes may be needed. Coughing and phlegm. Accumulation of fluid in the lungs or chest cavity is common in pleural mesothelioma and produces chronic coughing, sometimes with blood-tinged phlegm. Preventing infections like pneumonia, managing symptoms, and draining fluid buildup are ongoing struggles. Digestive issues. The peritoneal form of mesothelioma affects the abdominal cavity and can cause bowel obstruction, abdominal pain, nausea and vomiting as tumors develop. Keeping patients well nourished and hydrated with support is a challenge when they can't eat or keep food, liquids down. Progression of disease. Although new treatment options offer longer survival times than in past decades, mesothelioma ultimately spreads in most patients. Managing worsening symptoms and declining functional status as the cancer progresses towards end of life poses difficult challenges. Treatment side effects. Chemotherapy, radiation and surgery used against mesothelioma often cause their own side effects like fatigue, anemia, hand-foot syndrome, diarrhea and more that need managing concurrently. In addition to medical challenges, zeolite mesothelioma patients face significant emotional and lifestyle adjustments. Fear and anxiety. Dealing with a terminal cancer diagnosis understandably brings feelings of fear, sadness, depression and anxiety about the future. Psychosocial support helps patients and caregivers cope. Disruption of life plans. Mesothelioma strikes usually in a patient's 60s, 70s and cuts short retirement plans or time with family. Adjusting goals and finding meaning requires emotional resilience and spiritual support. Family stress, caregiving demands, financial pressures and uncertainty place strains on relationships that counseling may help navigate. Maintaining family cohesion and normalcy is challenging. Loss of functional abilities. As mesothelioma progresses and physical reserves decline, patients lose independence and require increasing assistance even with basic activities like bathing, dressing or using the toilet. This loss of autonomy and dependence on others can be psychologically difficult. Travel limitations, frequent medical visits, intolerance of long car, plane rides and poor prognosis limit travel opportunities that were previously enjoyed. Finding stimulating local activities helps combat isolation and boredom. Financial toxicity, out-of-pocket costs for medical care, experimental treatments, lost wages, travel for appointments and disability can sometimes overwhelm families even with insurance. Assistance programs help address this challenge in some cases. Employment disruption. Few patients can maintain full-time employment through an arduous mesothelioma illness. Managing loss of income, health insurance changes and filling time constructively are ongoing concerns. End-of-life decision-making. As prognosis becomes terminal, goals of care conversations, hospice consideration, Advanced care planning, organ donation and funeral preparation place both emotional and practical burdens on patients and loved ones. Supportive care helps navigate these difficult end-stage challenges. Zeolite exposure mesothelioma patients face extensive medical issues as well as personal, emotional and lifestyle adjustment challenges as they battle this deadly cancer. A multidisciplinary care team approach is crucial to optimally address the physical, psychological and practical needs of patients and caregivers throughout the disease course.